Welcome back, everybody, for another deep dive with us.
Always fun.
Yeah, so today we're going to be looking at something pretty interesting, I think, in the medical space, specifically something that's happening in Australia.
Yeah, lots of buzz around this one,
Yeah, and it has to do with this drug Wegovy,
right?
which people in the U.S. might know this drug already
Yeah, it's been approved there for a little while.
for weight loss.
Yeah.
But in Australia, it was just recently approved for something else.
Yeah, for heart disease in overweight and obese patients.
And that's a big deal.
Yeah, huge actually.
Yeah, so we've got 3 articles today, all from Australian publications, and all about this approval by the TGA, the Therapeutic Goods Administration.
Mm-hmm.
And yeah, I mean, there's some big questions here, like what does this mean about patients?
Yeah.
How does this fit in with everything else that's going on with obesity and heart health?
Right.
And is this really this new frontier that some people are saying it is?
Big questions.
Big questions.
Let's dive in.
Okay, so the approval came through in December.
Right.
And this is not like any other approval, is it?
No, it's not because this approval is for a specific use
Okay.
or indication, as they call it.
Right.
So what the TGA is saying is that Wegovy is safe and effective for treating heart disease in overweight and obese patients. But that's the only thing they're approving it for.
For this specific indication.
Right.
So just because it's approved, does that mean that everybody who needs it can get it?
That's the question, isn't it? And it's actually a lot more complicated than you might think.
Okay.
So approval doesn't automatically mean that the government will subsidize it.
Right.
And without that subsidy, it's going to be really expensive.
Okay. So we'll get into that in just a minute.
Okay.
But first, can you kind of back up and just explain, like, what is Wegovy? Because it's not just like your typical diet pill, right?
No, it's not.
Okay.
It's actually the brand name for Semaglutide, 2.4 milligrams,
Okay.
which is in a class of drugs called GLP-1 receptor agonists or GLP-1 RAs.
Okay. I've heard of those, I think.
Yeah, you probably have.
But I don't really understand, like, how do those work?
So basically, you know that feeling you get after you eat a big meal?
Oh, yeah.
You're totally full. You can't eat another bite.
Thanksgiving dinner.
Exactly.
Rah.
Well, GLP-1 RAs, they kind of mimic a hormone in your body that sends that full signal to your brain.
Okay.
So you feel fuller for longer and you don't want to eat as much.
So it's working with your body's natural signals then?
That's right.
Okay. And you mentioned this is not brand new to Australia, right?
Not exactly.
Okay.
You've probably heard of Ozempic,
Oh, yeah.
which is also a GLP-1 RA, just a different formulation.
Right.
And Ozempic is already approved and subsidized here in Australia for type 2 diabetes.
So the key difference here is this is for heart disease, even in people that don't have diabetes.
Exactly.
And that's where this big select trial comes in, right?
That's right.
Okay. So can you tell us a little bit about that?
So this was a massive trial with over 17,000 participants.
Wow.
They were all over 45. They already had heart disease, and they were overweight or obese.
Mm-hmm.
But importantly, they did not have diabetes.
Okay.
They were given either Wegovy or a placebo, and they were monitored over time.
And what'd they find?
So the results were actually really impressive.
Okay.
Wegovy reduced the risk of major cardiovascular events like heart attacks and strokes by 20%
20%.
compared to the placebo.
That's huge.
It is.
Yeah. I mean, like, what other things out there that have that kind of impact on heart disease?
Not a lot.
Right.
And, usually we're celebrating gains of like 5% or even less.
Wow.
So 20% is pretty significant.
Yeah, and it's not just about weight loss either, is it?
That's right.
I mean, reading through these articles, it seems like it's doing more than just helping people lose weight. It's actually improving some of these underlying markers of heart health.
Yeah, so even the people in the study who didn't have significant weight loss, they still saw improvements in things like blood pressure and cholesterol levels and markers of inflammation.
So even if you don't lose weight, your heart's still getting healthier.
Exactly.
That's amazing.
It is.
So, I mean, this raises a lot of questions about how we think about obesity and heart health in general.
It does.
Like, maybe we need to rethink our whole strategy here.
Potentially.
Yeah.
Yeah.
This is really interesting, but I'm sure there are some challenges, right? Like, how do we get this drug to everybody who needs it?
Well, that's where things get a little bit tricky.
Okay, let's get into that then. Okay, so we've talked about the science and those trial results, which sound really impressive.
Yeah.
But with pretty much everything in healthcare, I imagine access comes down to affordability.
Yeah, pretty much. And with Wegovy, that seems to be the big sticking point.
It's not cheap, is it?
It's not.
No.
So remember how we were talking about Ozempic being listed on the PBS
Yeah.
for diabetes? Well, Wegovy is not subsidized by the government for this heart disease indication.
So you basically have to pay out of pocket.
Yeah, unfortunately, that's the case right now.
How much are we talking?
So our sources say it can be anywhere from like $345 to $645 a month.
Wow, that's a lot.
Yeah, it's a lot of money.
More than some people's rent.
Yeah, I know it's a real barrier for people.
I mean, it's kind of heartbreaking when you think about it because people might literally have to choose between their medication and like paying their bills.
Yeah, it's a real ethical dilemma, isn't it? When you
Yeah.
have these life-saving treatments, but not everyone can access them.
Yeah. So is there any talk about getting it on the PBS?
There is Novo Nordisk, the company that makes Wegovy. They've said that they're going to apply to the PBAC again this year.
Okay, so they're not giving up.
Not yet.
But didn't they already apply a couple of times and get rejected?
Yeah, they did.
So what makes them think that this time's going to be different?
Well, I think the landscape is changing.
How so?
Well, this new TGA approval for heart disease that carries a lot of weight,
Okay.
it's a signal to the PBAC that the evidence is growing.
Okay, so they're looking at it more seriously now.
Potentially, yeah.
But, I mean, the cost is still going to be a big factor, right?
Oh, absolutely.
Yeah.
The PBAC has to weigh the benefits of the drug against the cost to the healthcare system.
And I imagine that if millions of Australians could be eligible for this under this new indication,
Right.
then that could really blow out the budget.
That's their concern, exactly.
Yeah, and they're going to be looking really closely at that select trial data, aren't they?
Yeah, absolutely. They need to be sure that the benefits outweigh the costs.
Yeah. Okay, so it sounds like there's a bit of a road ahead.
Yeah.
But even if it doesn't become widely available anytime soon, just this approval itself feels like kind of a turning point.
It does.
Yeah.
For a long time, obesity has been seen as like, a lifestyle issue.
Right. You can just willpower your way out of it.
Right. Eat less, move more.
Yeah.
But this approval from the TGA, it kind of acknowledges that obesity is a complex medical condition.
Right.
And that it has serious health consequences.
Yeah. And maybe medication is a legitimate way to manage those risks.
Right. Exactly. And I think that's a big shift in thinking.
So maybe we'll start to see a more holistic approach then instead of just focusing on weight loss.
Hopefully, yeah.
So looking beyond just BMI.
Right.
And more at those underlying factors that actually contribute to heart disease.
Exactly. Blood pressure, cholesterol, inflammation, all of that.
Okay. So this really could be a new frontier then.
It could be.
Yeah, but are there any downsides? Are there any risks that we should be thinking about?
Well, with any new medication, there's always the risk of side effects.
Right.
We need to monitor that carefully.
Yeah, and I guess there's also the risk that people will see it as a quick fix.
Yeah, that's a worry.
And sort of use it as an excuse to not make any other lifestyle changes.
Absolutely. It's not a magic bullet.
Right, it has to be part of a bigger picture.
Exactly.
So where do we go from here? I mean, we covered a lot of ground today.
We have.
What are your final thoughts for our listeners? Well, this has been a fascinating discussion.
It has.
I feel like we've covered so much.
Yeah, we've gone deep.
But before we go, I'd just love to hear, what are your key takeaways from all of this? What's the big picture here?
Well, I think for me, the biggest thing is just how much this could change how we approach obesity and heart health.
Yeah.
And we're finally starting to recognize that obesity is a medical condition with serious consequences.
Not just a cosmetic thing or a willpower issue.
Right, exactly. And the select trial results really show that.
Yeah, 20% reduction in heart attacks and strokes. That's amazing.
It is. And even in people who didn't lose a lot of weight.
That's what's so interesting to me.
Yeah, so it seems like it's really getting at those root causes.
Working on a deeper level.
Yeah, and that's why this could be such a game changer.
But of course, there's that big question of access.
Right.
I mean, it's great that it's approved, but if people can't afford it, what's the point?
Yeah, that's the challenge, isn't it?
Yeah.
How do we make sure that everyone who needs this medication can actually get it?
And that's a much bigger conversation, isn't it?
Yeah, it is.
It's about healthcare as a whole.
Ab-
And how we prioritize health and well-being in our society.
Exactly.
So where do we go from here? What's the next step?
Well, I think we need to keep asking these tough questions.
Yeah.
About who deserves access to treatment and how we balance the cost with the benefits.
And this is just the beginning of that conversation.
It is. The science is always evolving and the policy is changing.
So we need to stay informed and keep pushing for better solutions.
Exactly.
Well, this has been an incredible deep dive. Thank you so much for joining me.
My pleasure.
And for everyone listening out there, thanks for tuning in. We'll see you next time for another deep dive.